Bonjour à tous. Hello, everyone. Kwe. Before I begin, I would like to acknowledge that we are gathered on the traditional and unceded territory of the Algonquin Anishinaabeg people. We acknowledge them as past, present, and future caretakers of this land. Bienvenue, welcome. Je suis très heureuse d'être parmi vous aujourd'hui à l'occasion de cette importante annonce sur le régime canadien des soins dentaires. Une fois mis en œuvre, ce plan contribuera à réduire les obstacles financiers à l'accès aux soins bucco-dentaires pour près de 9 millions de résidents canadiens non assurés, une mesure qui comble un écart important à travers le pays. And we just had the privilege of visiting where students learn on this important job that they will have very soon. And I wanted to recognize them because they took the time today during exams in their last 6 days of work and studying. So I want to say thank you to Taylor, Amy, Priya, Vishnu, and Jody for being with us today. See, they're smiling because they can see what's happening in 6 days. Thank you for being here. Merci beaucoup. And I also want to extend a big thanks to Algonquin College, all the staff and professors for being here today and hosting us on this very important day. And I would now like to invite the President, Claude Brûlé, to say a few words as we begin this new announcement.
Thank you, MP Fortier. Good morning, everyone. Bonjour à tous et à toutes. Kwe. I am Claude Brûlé, President and CEO of Algonquin College. Let me offer a warm welcome to everyone gathered here this morning at our Ottawa campus for this historic announcement. I am pleased to welcome our guests, including Ministers Mark Holland, Terry Beech, Jean-Yves Duclos, and Seamus O'Regan, as well as a number of members of Parliament, including Mona Fortier, Ottawa Vanier, and Marie-France Lalonde, Ottawa Orleans. And I know that Mona will introduce, there are a number of additional MPs here with us this morning, and Mona will introduce them in a moment. We're also welcoming a number of key community stakeholders this morning into one of our many Indigenous spaces that exists on our campuses. And MP Fortier gave our land acknowledgement, but let me expand a little bit on this. Algonquin College takes great pride in its commitment to making First Nations, Métis, and Inuit knowledge, worldviews, and traditions an integral part of the institution's culture. Over the years, this has included establishing a variety of Indigenous spaces on campus. This particular space is called Nawapun, and it means gathering strength for the journey. When we use this space, we are reminded of the importance of honoring the land on which we stand and the rich culture of the Anishinaabe Algonquin people. Algonquin College is the largest community college in Eastern Ontario, providing flexible and personalized industry expert-led polytechnic-level education and training at our campuses in Ottawa, Pembroke, Perth, and AC Online. We equip our market-ready graduates with global competitive knowledge and skills that allow them to hit the ground running and be effective contributing members of any organization they join. We are immensely proud of being an integral part of the economic engine and the cultural fabric of the National Capital Region, the province of Ontario, and Canada, and helping employers in every sector to find the skilled talent they need for their success and prosperity. And with that, I'm pleased to invite back to the podium an advocate of colleges and a friend of Algonquin College, Member of Parliament for Ottawa Vanier, Mona Fortier.
Well, I have to say, I love coming to this campus. I had the privilege of working at Collège L'Estée, and both colleges are really incredible in this region. And so many students have the privilege of studying here. So thank you so much, and thank you to faculty. And again, I remind everyone, it's exam season. So it's really important that we recognize they take the time to have us today, to host us today. We are privileged, of course, to be joined here today by my colleagues, the Honourable Jean-Yves Duclos, Minister of Public Services and Procurement Canada, the Honourable Terry Beech, Minister of Citizen Services, the Honourable Seamus O'Regan, Jr., I like saying that, Minister of Labour and Seniors. And I also want to acknowledge my colleagues here that made the time to come, Marie-France Lalonde, Annie Koutrakis, Mike Calloway, Wilson Miao, Jean Yip, and Don Davies. Thank you for being here today. Now, you'll have an opportunity to hear my other colleagues, minister colleagues that I mentioned, but now it's time to hear Minister Holland. Alors, ça me fait un grand plaisir de vous présenter non seulement un collègue, mais un ami, l'honorable Mark Holland, ministre de la Santé. Minister Holland was first elected as the Member of Parliament for Ajax in 2004 and served until 2011. And then he was re-elected in 2015, 2019, and 2021. And he currently, have you made your math? He's serving his sixth term. A lifelong resident of the Ajax Pickering area, Minister Holland has served his community for over 20 years. And as a Member of Parliament, Minister Holland has served as Leader of the Government in the House of Commons, as Chief Government Whip, as Parliamentary Secretary to the Minister of Public Safety and Emergency Services, and as Parliamentary Secretary to the Minister of Democratic Institutions. He has been a staunch advocate of marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. Dans ses fonctions publiques et privées, le ministre Holland a appuyé des initiatives liées à la santé. He served as Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth, and helped to secure funding for Grandview Children's Center's future Ajax location. Mesdames et messieurs, veuillez vous joindre à moi pour accueillir sur la scène mon collègue et ami, le ministre Holland.
Merci beaucoup, Mona. C'est un grand plaisir d'être ici pour un jour tellement historique. Et au début, je veux dire merci à Jean-Yves Duclos pour son travail extraordinaire comme l'ancien ministre de Santé. Et je vais parler après quelques moments sur notre relation aussi avec Don Davies. Et j'apprécie Don beaucoup aussi. Et je veux dire merci aussi pour toute l'équipe à Santé Canada, particulièrement Lynn et Lindy et Steve et toutes les autres pour leur travail acharné. C'est absolument extraordinaire. Sans leur travail, c'est absolument impossible d'être ici aujourd'hui. Et merci beaucoup pour ça. I want to thank Algonquin College as well and to welcome our oral health care partners to what is a truly monumental day for health in Canada. It's transformative. A third of Canadians today do not have access to dental insurance through their employer. 1 in 4 have said they were unable to visit an oral health professional because it was too expensive. And let's talk about what that practically means, because oral health is health. When somebody doesn't get the oral health care that they need, it means they're going to have issues cardiovascularly, it means with diabetes, or a myriad of other chronic disease and illnesses. So it isn't just about the social justice of somebody being able to wake up and go to work with a healthy smile. It's fundamentally about their health. As Minister of Health, I'm deeply proud that Canada has one of the best health systems in the world. But we know we can do better. We know we can have the best health system in the world. And today is a monumental step in that direction. Today, we're here to share with you the details of the Canada Dental Care Plan and what it means. Up to 9 million Canadians today do not have dental insurance. This action today will help support them to get the access they need to oral health care they need and deserve. Far too many people have avoided getting the care that they need simply because it was too expensive. And that's why this plan is essential. With the Canadian Dental Care Plan, they won't have to anymore. It's going to help make life better for eligible Canadian residents because they won't have to make the choice between paying their bills and getting the care that they absolutely need. The Canadian Dental Care Plan will cover a wide range of services for Canadians. It will cover preventative, diagnostic, restorative, surgical, among other services to ensure their smile is healthy and joyful. These include x-rays, fillings, root canal treatments, and dentures. You know, to put it in a really practical term, and I've had this experience a lot, and I had an opportunity to talk with Seamus because this is going to mean so much for seniors, but to put it in practical terms, I was at Spencer House in Nova Scotia, and I was talking with a group of seniors who said to me, Mark, this isn't really going to happen. I've had the same dentures for decades, literally, and I don't have the money to replace them. And when I said, no, this is real, it's going to happen. One of the most powerful moments for me politically, you know, in my political life, to see that look of optimism and joy and what that dignity would mean. The dignity of being able to get those dentures replaced, of getting the oral health care that they deserve, what that meant to those people's lives. I know, Seamus, you're going to talk about that, but it was deeply touching and powerful to me. You know, speaking to oral health professionals who are devastated because they have to wait, and I'm looking at Heather, and the conversation, Heather, you and I had, about people who can't get the care they need, and so they have to wait till their situation deteriorates so enormously that they have to go into an emergency room and get it done with as an emergency at enormous additional cost, not just to our health system, but to the dignity of that person, having to wait until their health situation deteriorated to that state. And that's why I want to take a moment to address our oral health professionals. I've met with many oral health professionals, and I know they are passionate, deeply passionate, about providing the best health care for Canadians. I'm excited to be launching this new program for Canadians, knowing that we have such a committed group of oral health professionals working in all communities across this country. We've got a lot of work to continue to do as we move forward to starting this program. They have told me that they worry about people who don't have access to oral health care, and they know that better than any of us, the importance of enabling Canadians to not only get what they need to improve their oral health, but to ensure that their oral health is taken care of. Because when people don't have access to dental care, as I mentioned, they have to go to an emergency room. That costs millions of dollars to Canada's healthcare systems, and it's a fundamentally unjust outcome. This isn't just about helping Canadians access the care that can improve their oral health. It's also about building a stronger overall health system for Canada, about coming from health in every direction. With a plan that will help so many people across this country, we want to make sure this is a smooth and positive experience for Canadians. That's why we're going to be opening application in phases, starting with seniors and then people with disabilities, children under 18, and then ultimately by 2025, all eligible Canadians. This week, we're sending invitations to apply letters to seniors 87 and older. Once they are enrolled, seniors will be able to access oral health care as early as May of 2024. Every month, we will see more people be able to book their appointments with their oral health professionals. Look, this is a proud moment, I think, for all Canadians in expanding what is the definition of health care in Canada. I want to thank all of my colleagues for their extraordinary work to get to this point. The Canadian Dental Care Plan is a vital part of our government's plan to help Canadians get better health care and to make life more affordable. Avec ça, c'est un grand plaisir maintenant de présenter le ministre Jean-Yves Duclos. Merci beaucoup.
Merci beaucoup, Marc. Merci, Mona, de cette gentille introduction. Bonjour à tous et à toutes. Good morning, everyone. Comme nous le savons et comme nous l'avons entendu, les soins dentaires sont essentiels à la santé globale. Une bonne santé bucco-dentaire joue un rôle important dans la prévention du cancer, du diabète, des maladies respiratoires, cardiovasculaires et cérébrales. Le report des soins dentaires, dont Marc a parlé, peut entraîner en effet de lourdes conséquences, notamment des traitements plus douloureux, plus coûteux, une détérioration de l'état général de santé, des problèmes de sommeil, des absences répétées de l'école et du travail, en particulier pour les personnes à plus faible revenu. Mais pour beaucoup trop de ces personnes, le coût des soins dentaires est tout simplement hors de portée. Environ un tiers des Canadiens et des Canadiennes hésitent en effet à consulter un professionnel de la santé bucco-dentaire parce qu'ils n'ont tout simplement pas l'argent pour couvrir les frais d'assurance. Nous pouvons et nous devons faire mieux. Vous vous souvenez probablement qu'en décembre 2022, le premier ministre Trudeau a annoncé la première phase de notre plan visant à améliorer l'accès aux soins dentaires en lançant la prestation dentaire canadienne, une prestation qui fournit aux parents admissibles un paiement direct pour les aider à couvrir le coût des soins dentaires de leurs enfants de moins de 12 ans. À ce jour, près de 395 000 enfants ont pu en bénéficier. Mais les enfants ne sont pas les seuls à avoir besoin d'un meilleur accès aux soins dentaires abordables. We have worked in that context extensively with many partners that Mark already mentioned. And I would again mention the very hard work and the strong collaboration of Don Davies from the very start of our collaboration to deliver on our commitment to improve access to dental care services and make life more affordable for Canadians. As former Minister of Health and the current Minister of Public Services and Procurement, I am very grateful to be here with my colleagues to announce the next steps in the rollout of the new Canadian Dental Care Program. Public Services and Procurement Canada led an open, transparent, competitive, and multi-stage procurement process to select the third-party administrator for the plan, which will begin rolling out by early 2024. Following this robust process, a contract valued at more than $740 million was awarded to Sun Life Insurance Company of Canada to take the helm of this important initiative. An early work agreement, awarded on September 6, 2023, allowed Sun Life to undertake the necessary preliminary work to ensure the timely launch and the successful implementation of the Canadian Dental Care Plan, while the details of the main contract were being finalized. Thanks to a competitive and agile procurement process, today we are even closer to ensuring all Canadians have access to quality dental care. In fact, as was mentioned, applications for membership in the Dental Care Plan will begin to be accepted this month. En raison du potentiel de forte demande pour ce régime, nous procéderons à une adhésion par étapes, en commençant tout de suite par les personnes âgées, avec un processus simple et direct. Des lettres d'invitation seront envoyées selon les groupes d'âge, en débutant avec les personnes âgées de 87 ans et plus, dont les lettres seront envoyées dans les prochains jours. Nous passerons progressivement aux personnes âgées de 70 ans et plus d'ici mars 2024. Des lettres seront envoyées à tous les aînés potentiellement admissibles avec des instructions sur la manière de valider leur admissibilité. Les aînés qui recevront une lettre d'invitation pourront téléphoner à Service Canada pour faire une demande d'adhésion et n'auront qu'à répondre qu'à quelques questions. De plus, d'ici mai 2024, un portail de demande en ligne sera ouvert à toutes les personnes âgées de 65 ans et plus. Soutenir les personnes vulnérables et les aînés n'est qu'un début. Éventuellement, un plus grand nombre de Canadiennes et de Canadiens pourront adhérer au régime. En réduisant les obstacles financiers, le régime canadien de soins dentaires permettra à terme à quelques 9 millions de Canadiens non assurés d'obtenir les soins dentaires dont ils ont besoin. Il s'agit de l'un des programmes de soins dentaires financés par l'État les plus utiles au pays. En terminant, soyons clairs, personne ne devrait avoir à choisir entre sa santé et payer ses factures. Nous ne devrions pas pouvoir deviner le salaire d'une personne selon son sourire. Nous souhaitons travailler à cet égard à ce que toutes les Canadiennes et tous les Canadiens, quelle que soit leur situation économique et quelles que soient leurs conditions, puissent recevoir les soins dentaires essentiels dont ils ont besoin. Et nous allons continuer à être là pour celles et ceux qui en ont le plus besoin, tout en rendant la vie plus abordable et en bâtissant un avenir plus juste et plus sain pour les générations actuelles et futures. Merci. Thank you.
Hello, everyone. Bonjour à tous. Thank you to all the colleagues that are here. Thank you to all the members of Parliament who just happen to represent ridings from every region of the country. Thank you to all the professionals that are here today and all of the staff and individuals who have helped make today happen. This is the largest public benefit rollout of any program of any government in Canadian history, which is very exciting. But for that reason, it is very important for us to deliver this benefit in a responsible and predictable way. So, as of today, I'm happy to inform everyone here that Service Canada locations across the country have been trained up on the benefit and the phased rollout. As of next Monday, we will have a fully functioning call center up and running to help Canadians with hundreds of trained professionals who are going to start working next Monday and throughout the holidays. To ensure the best possible client service experience, we are taking a phased approach to onboarding Canadians that will take place between today and 2025. The first major point that I want to emphasize, and you'll probably hear me say this exact thing 3 times throughout my speech, because if there's only one thing I would stand up here and say, it would be this. There is no proactive action that any Canadian needs to take today in order to enroll, other than making sure that you're up to date in filing your taxes. That's all you have to do as of today to prepare for the rollout of the dental benefit. We think up to 9 million Canadians will qualify for this benefit, and if we are able to phase that out perfectly, that is still up to 25,000 Canadians a day, every day for the entire year. So we have made sure to enroll people in phases in order to make sure that we are able to do that in a responsible way. Seniors 70 and up will start receiving invitations to apply via the mail, and only via the mail, starting December 18th through to March 2024. To be precise, individuals 87 years old and up, their letters will be going out this week. 77 and up in January, 72 in February, and 70 plus in March. Those individuals will receive a letter in the mail with instructions on how to enroll. The first group, all those seniors 70 and up, will sign up using the telephone. They will need their SIN number and a unique code that will be included on the letter that will be sent to them in the mail. As part of the application, they will have to attest that they don't currently have access to private or employer family dental plan. Service Canada will then pass on the information of individuals who qualify to the third-party administrator, Sun Life. Sun Life will then send a welcome package that will include the services that will be covered, a member ID card, and their coverage start date. Starting in May 2024, we will switch from a telephone system to online. Also in May, individuals Okay, am I back now? Okay.
You're good. You're good, Terry.
Am I? Okay. It's a nice break in the... And we got some fun stories I want to tell?
So thank you, Terry, for throwing it to me 7 minutes ago. Thank you, Claude. Merci, Mona, Mark, Jean-Yves, Jean, Wilson, Mike, Parm, Annie, Marie-France. We have all of Canada represented here, which I think is quite appropriate. This is a really important national announcement. Au Canada, on prend soin de nos citoyens. Le supplément de revenus garanti, les soins de santé publique, les garderies abordables, et maintenant, des soins dentaires. As Minister for Seniors, my job is about dignity, about making sure that seniors in Canada can age in health, in safety, and in dignity. The dignity that comes with a smile. The dignity that comes with a smile that you want to share with the world. That comes down to choice, to inclusion, to community, but largely to affordability. Being able to afford basic things like getting your teeth cleaned, your dentures. This part of the Canadian Dental Care Plan was designed for seniors. We listened to seniors, to experts on what they needed, both in terms of coverage and in terms of the application process. We listened. I heard directly from the National Seniors Council on what they felt we needed to make this plan effective. Officials in the Seniors Branch of Employment and Social Development Canada did a lot of testing on the letters and websites to make sure that they were understandable and they were easy to use. As Minister Beech said, the application process was created to get as many people into the dentist chair as soon as possible. Letters will be mailed to eligible seniors, inviting them to apply for the plan. This letter will include a personalized application code and instructions on how to apply. We're in touch with dentists and clinics so that they know about the program and know about the requirements so that they can get eligible seniors in their communities enrolled. Seniors have different needs as they age. Some of the plan covers preventative care, including cleansing and polishing, diagnostic services, including exams and x-rays. It covers complete and partial removable dentures. Finally, I'll just say that we have done a lot of good work with MP Don Davies and with the NDP over the last year and a half, and this is a shining example. Very proud of the work that I've done with his colleague, Alexandre Boulerice, on a ban on replacement workers. We really do get a lot more done when we work together, and I'm very proud to have worked with Don and Alex on these two very important initiatives. Back to you, Mark.
Thank you, Seamus, and I completely agree. This day is historic not only because of what it means for Canada's healthcare, Canadians' healthcare, but also because it was made possible with parliamentary cooperation. Don and I have had an opportunity to work on a lot of files. We were both critics for public safety, and where I got to know Don's heart and character as somebody who deeply cares about this country and who works tremendously hard. And now as the NDP's health critic, we get an opportunity to work on a lot of issues, and I'm deeply fortunate to be able to continue that relationship. It's Don's advocacy and working so closely with Jean-Yves and then with myself and then with our other parliamentary colleagues that was absolutely instrumental in making sure that today was able to happen. And I think it's precisely what Canadians want us to see. They want to see parliamentarians working together to get things done. And today certainly is very much in the spirit of that. And with that, it's my great pleasure to introduce Don Davies, who's the health critic for the New Democratic Party.
Merci, bonjour tout le monde. We should do this more often. It's a tremendous honor to be here today. C'est un moment historique. This is a truly historic moment, one that has special significance for me as NDP health critic, because today we are building on the legacy of the NDP's visionary first leader, Tommy Douglas, who laid the foundation for our country's public health care system over half a century ago in Saskatchewan. He believed then, as we do now, that every Canadian should have access to head-to-toe health care through our publicly financed system as a matter of right and not privilege. Tommy then used his influence in a minority parliament in the 1960s to help make universal access to hospital and physician services a reality for everyone, working again with the Liberal government of the day. In this minority parliament, New Democrats have once again worked constructively to achieve another healthcare breakthrough. By working in cooperative partnership with our Liberal colleagues, New Democrats have helped secure dental care for 9 million Canadians. It's no exaggeration to say that this is the biggest expansion of public health care in Canada in many generations. Le NPD a utilisé son pouvoir pour offrir des soins dentaires à 9 millions de Canadiens. Il n'est pas exagéré de dire qu'il s'agit de la plus grande expansion des soins de santé publique au Canada depuis des générations. I hope you study hard because we're going to need you and many more like you to help service all of these new people who are going to be going to dental professionals. As has been said, the Canadian Dental Care Plan will be transformative for millions of Canadians who currently cannot access this essential primary health care service. I want to underscore that. Oral health care is not a luxury, it's not a cosmetic issue, it's primary health care need. This will profoundly improve the overall health and quality of life. We know that poor oral health has serious consequences. It leads to pain, infection, tooth loss, poor nutrition, and increased risk for chronic diseases such as diabetes, cardiovascular damage, and respiratory illness. Untreated dental problems often result in costly and avoidable visits to emergency departments, adding unnecessary strain on our overstretched hospital workforce. It affects people's mental health and self-esteem, reducing job prospects and creating stigma. It's the #1 reason children miss school in Canada. Lack of access to dental care is also a fundamental social justice issue, as it disproportionately affects the poorest and most marginalized Canadians among us. So this announcement today will start to change this unacceptable state of affairs. It will put smiles back on the faces of millions of Canadians. And in a time of great economic pressure, this program will save Canadians much-needed funds and make their lives more affordable. I want to thank all of my colleagues for their efforts to make this moment possible. In particular, I'd like to recognize Minister Duclos for his work and his teams in the early stages of our agreement, and Minister Holland and his team for his drive to get us over the finish line. I'd like to thank my staff and advisors who worked with diligence and optimism to construct a national program that many said could not be done. I want to thank our talented civil servants whose professionalism and skills were pivotal in making this day happen. I'd like to thank the many stakeholders for sharing their expertise and giving us their advice. I'm sure we'll be getting a lot more of it in the days, weeks, and months to come. And I would like to thank my leader, Jagmeet Singh, for fighting for this historic program that will change people's lives. Finally, I'd like to thank Prime Minister Trudeau and our leader, Jagmeet Singh, for doing something rare in politics, for reaching across the aisle, for finding common ground, and for cooperating for the collective benefit of all Canadians. Today's announcement is a key reminder of what we can achieve when we focus our energy on delivering results for people. Alors que Pierre Poilievre et son équipe sont occupés à voter pour réduire le financement des services dont les gens dépendent, le NPD livre des résultats avec un programme national de soins dentaires. While Pierre Poilievre and his team are busy voting to cut services people rely on, the NPD has been working hard to deliver concrete results for people. Although dividing Canadians and focusing on what's broken may be an effective way to exploit frustration and fear, it denigrates our politics, and it doesn't get results for people. As Jack Layton would often remind us, the opposition's job is not just to oppose, but to propose. Today, we see the results of that kind of positivity and vision. I want to acknowledge that there's still much work to be done. While this program is a significant down payment on public dental care, it is not universal. I've lost the other sheet of my paper here. One moment, please. For New Democrats, we will continue to work to build a truly comprehensive public healthcare system that covers all Canadians from head to toe. But today, my friends, we celebrate. what is an impressive and rare accomplishment, a groundbreaking program that will help millions of Canadians access primary health care that most of us take for granted. And so I will conclude my comments on this remarkable day with words from Jack Layton's final letter to Canadians. We can be a better, fairer, more equal country by working together. Don't let them tell you it can't be done. Today, by working together, we got it done. Thank you.
Merci beaucoup, Don. Thank you so much, MP Davies. And, you know, this is it. Hope and hard work equals results. And that's what we've done together. So thank you very much for being here. And it's such a welcome announcement for Canadians. And I know that we are very happy to be here today to share in it. This is working together, working hard for Canadians. And this, of course, concludes the very important and historic announcement. Now we got to get to work. Send those letters, make sure everybody knows about this program. Alors, sachez qu'aujourd'hui, c'était une annonce, mais on vous invite évidemment à voir comment on va pouvoir livrer et mettre en œuvre ce programme. Vous allez retrouver sur les plateformes du gouvernement du Canada l'information nécessaire. Alors, n'hésitez pas à aller voir pour s'assurer que si vous êtes admissible à ce programme, que vous pouvez y avoir accès. Again, I want to thank all of our guests here at Algonquin College and those who have joined us virtually. And this, of course, colleagues, concludes the formal announcement portion of our event this morning. I will now turn the floor over to Media Relations to begin the question and answer period. Merci beaucoup. Thank you. Miigwech Nakumik.
Thank you, merci. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question and one follow-up. If you could line up with me, that would be great. Nous commencerons par les questions dans la salle avant de prendre des questions sur Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question et un suivi. Merci veuillez vous mettre en ligne.
Merci. Bonjour, Valérie Gamache de Radio-Canada. J'aimerais vous entendre peut-être en français, je ne sais pas qui peut le faire, mais sur la véritable capacité de répondre aux demandes qui seront nombreuses. Je sais que M. Beech l'a évoqué en anglais. Est-ce qu'il y a des gens qui ont été ajoutés pour répondre donc à l'afflux auquel on peut s'attendre?
Oui, c'est une bonne question et c'est évident que c'est impossible de s'assurer que chaque personne peut recevoir le service que la personne a besoin. Et ce n'est pas parfait au début. Et on doit travailler tellement fort, particulièrement avec les personnes dans la campagne ou dans les communautés plus distantes. Ça va prendre le temps. Ça, c'est la raison pour laquelle on a une quantité d'argent spécifiquement d'augmenter l'accès. Et je dois travailler aussi avec l'industrie et la conversation, ça continue. Et parce que la demande est absolument énorme. Mais c'est essentiel quand même de commencer. Et je pense que c'est possible pour les millions de personnes de recevoir le service aussitôt que possible. Et on peut améliorer ça avec le temps. Et il y a beaucoup de travail à faire.
Et peut-être pour M. Duclos, il y a évidemment des programmes dans les provinces. Et là, évidemment, je pense au Québec. Est-ce qu'il y a un ajustement qui se fait avec les provinces? Comment ça va se déployer là, entre le fédéral et le provincial?
Merci. Je vais répondre en deux morceaux. En revenant à la question antérieure, si la question pose sur les services de Service Canada au cours des prochaines semaines, la réponse est qu'au cours des dernières semaines, un grand nombre de travailleurs de Service Canada ont été formés pour pouvoir commencer à répondre aux questions des gens lundi prochain. Il y a dans les prochains jours des centaines de milliers de lettres qui vont être envoyées aux aînés de 87 ans et plus, et davantage pour les aînés de 77 ans et plus au cours des prochaines semaines jusqu'à la fin janvier. Ces gens vont donc être capables de répondre aux questions dès lundi. Il y a des employés en nombre important et s'il y a besoin d'en ajouter davantage, il y a des contingences qui sont prévues. Maintenant, sur les questions de relations avec les provinces et les territoires et avec le Québec en particulier, la réponse est que l'annonce de ce matin est bonne à la fois pour les Québécois et pour le gouvernement du Québec. Il y a des centaines de milliers de Québécois. On estime à près de 2 millions de Québécois qui n'ont pas présentement accès à une assurance dentaire et qui n'ont pas les moyens de se payer des soins de santé dentaire. Plusieurs de ces Québécois sont des aînés qui vivent avec de petits revenus et qui n'ont pas d'assurance, y compris d'assurance privée. Alors, c'est une bonne nouvelle pour eux, mais c'est aussi une bonne nouvelle pour le gouvernement du Québec. On sait que livrer des soins de santé à une population vieillissante est un gros enjeu. Beaucoup de ces aînés et de ces plus jeunes Canadiens et Québécois se retrouvent à l'urgence dans des conditions qui nécessitent des coûts de santé plus élevés et plus douloureux. Donc, ça va permettre d'aider à éviter que trop de ces gens se retrouvent dans des endroits où ils ne devraient pas être s'ils avaient eu accès à des soins de santé préventifs en premier lieu.
Hi there, good afternoon. Is it afternoon? It's still morning. Marina von Stackelberg from CBC National News. My questions are for Minister Holland. You mentioned in your press release that you're encouraging provinces and territories to maintain their existing programs, but do you have a guarantee from them that they won't dismantle their existing dental care programs once this one is fully up and running?
Well, thank you. The intention here is to fill the gaps, is to make sure that folks get the oral health care that they need and deserve. And so the conversations that I've had with my provincial and territorial counterparts have been extremely positive. I know that their intention is to see an augmentation of service and to work collaboratively with us. This is, I think they understand this is an opportunity to shove off costs. This is an opportunity to help the health of Canadians and to fill in the gaps, and that's how this program has been designed. And that's how the basis of the conversations that we've had with my provincial and territorial counterparts.
Hello. Okay, thanks. For my follow-up question, $13 billion is not a small amount of money. What is the business case for this program?
Well, the business case, and I thank you for the opportunity to make it more explicitly. It's tough to invest in prevention because its impacts can somewhat seem invisible. We're going to wake up in a society that day by day is healthier and more just. And the costs that are avoided, and let me just give you an example. When I'm talking to oral health care professionals who are devastated by the fact that they're seeing people who, because they don't have access to care, wait until that becomes an enormous crisis in their health, and they go into a hospital. The cost of that care is huge. The cost of lost productivity and employment is huge. The cost of somebody who has an oral health issue where they can't get access to the care that they need, and so they don't have a smile that they feel comfortable with or proud of, let alone the fact that it generates. And I can tell you, when I was at Heart and Stroke, the cost of a cardiovascular event, the cost of diabetes. As a society, we need to start looking at the investments we make now, not only as a matter of social justice, but as a matter of productivity, as a matter of cost avoidance. So yes, there certainly is a cost to make sure that everybody has access to the oral health care they need. But we get to wake up in a society where people have access to that. That's not a small thing. And I am certain with time, as we're going to be able to demonstrate, and I think we have an excellent partnership around rigor of data collection and rigor of impact to be able to demonstrate the enormous cost avoidance that this is going to mean.
News. I suppose my question is still for the health minister. We're now looking at a program that could increase the amount of dental patients in the country by 9 million. There's still a limited amount of dentists. A supply and demand issue might come up here. What is the incentive for dentists to take on these new patients that are part of the federal program?
Well, thank you for that. And we're working closely with providers. We've had great conversations before me, Jean-Yves Duclos, but we still have work to do working with providers. And you're absolutely right. At the core of the success of this plan is to make sure that oral health professionals are signing up. But I can tell you what we agree on. we agree that oral health is health and is essential to the health and well-being of our country. I've been deeply impressed in the conversations that I've had with oral health care professionals as we navigate these issues, that they want this. They've been advocating this for decades. You know, they want to make sure that every Canadian has access to oral health. Now, what we have to make sure in that process is that we're working with oral health care professionals and treating them fairly, and that we're finding ways to work together. And I think we've been having very productive conversations on that basis. And so I'm extraordinarily optimistic that there is going to be very strong uptake. Now, let me also say, and that's why we have the Oral Health Access Fund, that just having dental insurance, it doesn't get you across the line. There's a lot of folks, you know, for persons with disabilities or people with special needs or rural, remote communities, people who've never had oral health care in their life and might feel ashamed to go in and get that access for the first time. We have a lot of barriers that we're going to have to overcome to get to the finish line of having equitable oral health outcomes for everybody. So it's going to be an iterative process, but we cannot allow perfection to be the enemy of progress. There is what we're going to see here with the Oral Health Access Fund is specific dedicated dollars to fight those access issues, to work with oral health professionals, to expand the amount of care that's available. So, you know, this is going to be a process of continual improvement to make sure that we make our health system ever better, and that includes oral health.
As a follow-up, then, what is the uptake? You're saying that you're trying to get oral health professionals to sign up. So how will this program work in terms of bringing the dentist chairs on board for these 9 million new patients that you're promising service to?
Well, it's first by making sure that that oral health professionals who want to see this, and I want to go back to that. They've been advocating this for a very, very long time. This is at the core of their heart. That all they're asking for is to be treated fairly. And I think those conversations have been extraordinarily productive. And I think as long as we get those details right, and I think we are, then I have no worry whatsoever. Because in the heart of every person who enters into health, and that includes oral health, is service and making sure that people are helped. And we're so deeply lucky to have the people who work in oral health profession who have that as their center, and you see it all throughout the health system. And so all we have to do is make sure that folks are treated fairly, and I'm absolutely certain that that means then people will get the care that they deserve.
Bonjour à vous, Olivier Ferrand-Boissé de TVA. Je voulais vous entendre là-dessus, Monsieur le ministre. Est-ce que l'impact de ce programme-là a été mesuré dans la capacité justement à fournir les soins? Puis est-ce qu'on va devoir éventuellement former davantage de dentistes, d'hygiénistes dentaires, d'assistants en vertu de ce programme-là?
Pour moi, c'est clair que l'investissement aujourd'hui, c'est pas juste un enjeu de justice sociale, c'est vraiment une question de prévention. Et avec nos partenaires, on va s'assurer que le donné est disponible, de prouver que l'investissement aujourd'hui peut prévenir beaucoup de maladies et beaucoup de dépenses à l'avenir. Et c'est important dans tous nos systèmes de santé de s'assurer que la prévention est notre début primaire. Parce qu'avec les préventions, c'est possible, oui, d'éviter la maladie, mais aussi de réduire le coût pour le système généralement. Peut-être Jean-Yves peut ajouter quelque chose.
Je vais ajouter rapidement que, de manière générale, et certainement au Québec, nos relations avec les partenaires du milieu de la santé bucco-dentaire sont excellentes, avec les facultés de médecine dentaire, avec les hygiénistes dentaires, avec les assistants et assistantes dentaires. On a pu, au cours des derniers mois, reconnaître les défis qu'il y a effectivement autour de la main-d'œuvre, les défis aussi d'accès physique à certains services préventifs pour les aînés, pour les personnes qui vivent avec des handicaps, pour les gens qui sont davantage marginalisés. Alors, on va utiliser, entre autres, le fonds d'accès aux soins dentaires qui va être lancé dans quelques mois, qui va commencer en 2025 pour accroître non seulement le nombre de gens capables de fournir ces soins dentaires. Ce n'est pas juste les dentistes, hein, il y a aussi les hygiénistes dentaires et les assistants dentaires. Donc, augmenter la main-d'œuvre capable de fournir des services, mais aussi augmenter la capacité des gens, dont parlait le ministre Holland, à se connecter physiquement aux milieux qui peuvent recevoir ces soins. Et ça inclut des milieux communautaires, des milieux universitaires, où il y a déjà des capacités présentes pour que les gens qui ont besoin de ces soins dentaires puissent y accéder, mais où on souhaite les développer encore davantage.
J'aimerais peut-être profiter aussi de la présence de votre collègue du NPD pour prendre des nouvelles d'un autre engagement, celui de l'assurance médicaments. La session, elle se termine bientôt. Est-ce qu'il y a encore de l'espoir pour déposer un projet de loi là-dessus avant la fin?
Je peux dire au début que c'est juste comme aujourd'hui ma relation avec M. Davies. Oh, je pense qu'il y a... Allô? Bonjour? OK. Ça marche? OK. Ça marche maintenant? OK. C'est clair qu'on a des discussions productives et il n'y a pas beaucoup de temps qui reste pour notre session parlementaire maintenant, mais Don et moi parlons presque chaque jour sur cet enjeu-là et je suis certain qu'il va y avoir des nouvelles sur ça bientôt.
Hi, Ministers. Laura Osmond, the Canadian Press. One of the first concerns that was brought forward by dental associations and dental healthcare providers at the outset of your work on this program was that employers would potentially drop their coverage, employees would opt out of their coverage, seniors who pay for their own coverage would stop doing so, and provinces could opt to stop offering those services as well. What is the government doing to prevent that from happening, and what would the cost implication be for this program if that did start to materialize?
Well, thank you. And again, it's so important to state that the objective here today is to fill in the missing gaps, to make sure that people who don't have access to care get care. So we're certainly working with industry and with insurance companies to make sure that that's the case. Remember that insurance covers a myriad of different services, including often cosmetic services. The intention here is people's oral health on a basis of getting care that they need. We are having conversations, not just like I talked about with provinces, but also with businesses, to ensure that we don't see that displacement, because it's incredibly important that we wind up with a system that fills in the gaps where everybody gets the care that they need, and where they have existing services that work, that they continue to use those existing services.
And have you looked at what the potential impact could be if that starts to materialize, and where the government may go from there?
Well, I think, we're at a stage right now where the conversations have been very productive, where we have very solid reason to operate on the premises of limited displacement. We have looked at the issue, and obviously if it began to move in a different direction, we would have a conversation. But I think engaging in a hypothetical that doesn't appear to be materializing wouldn't be advantageous at this point.
Finally, can I ask you for your response in English to the question on pharmacare? Only 4 days left to table that legislation by the deadline. How far apart are you, and what are the sticking points?
Well, what I can say is that the conversations that Don and I have been having on pharmacare have been extremely productive. We've had 4 months of really spending a lot of time together having conversations, and that I know we're both committed to getting it right. And that's first and foremost what's at the heart of our discussions. And so we are, going to be in a position, I think, in a very short period of time to give more information on that.
In the next 4 days?
Certainly we'll be saying something in the next 4 days.
Thank you.
Thank you. Time is quite tight. We're going to proceed to one question on Zoom, and we'll ensure to follow up with all journalists on Zoom who are waiting to ask a question. Le temps est assez serré, alors nous allons procéder à prendre une question sur Zoom et on va faire le suivi avec tous les autres journalistes sur Zoom. Merci.
Merci. Comme ma collègue a dit dans la salle, on a juste temps pour une question. Sorry about that. We only have time for one question on the Zoom. Comes from Hélène Buzetti, des Co-op de l'information. Hélène, à vous la parole.
Oui, bonjour, Monsieur le ministre. J'aimerais savoir Si les provinces abandonnent leur programme, quel serait le coût de ce programme-ci pour vous?
Je comprends bien les raisons pour lesquelles vous demandez votre question, mais pour moi, les conversations avec les provinces et les territoires sont tellement productives. Et certainement, l'objectif, les buts pour les provinces et les territoires est d'augmenter la qualité de santé pour leurs citoyens. Et avec nos conversations qui sont tellement productives, j'ai beaucoup de confiance qu'on peut trouver une bonne solution qui va s'assurer qu'on peut fill in the gaps. Et ça, c'est notre objectif, ça, c'est notre but.
And my follow-up is for Mr. Davies. You haven't answered my colleague's question. You were the one who most wanted this this other program on drugs to be tabled before the end of the year. This does not seem to be the case. So where are you at now? Is the red line still there?
Well, as the minister said, I would echo his comments that we're engaged in close and frequent conversation. We're having productive discussions and exploring a number of what I would call very exciting and creative possibilities to make progress towards universal national public pharmacare. I think that what's very important is that we get it right. If that ends up taking a little bit more time, then so be it. We think what's more important is that we get such a fundamentally important advance in our public health care system correct, rather than meet an artificial deadline. So, and you know, I'm not even precluding the possibility that we won't have something to announce the next few days. I'm still hopeful and optimistic that we can, but if we don't, we're going to keep working diligently in the weeks to follow to meet the spirit of our confidence and supply agreement.
Merci. Et ça conclut l'événement. Merci beaucoup de votre participation. Any further questions can be directed to media relations at the applicable department or agency. Thank you and have a nice day. Merci et bonne journée.